So very good morning to the student who have joined. Can you let me know in the chat box if my voice is audible and the video is visible to you? Also, if you can see the PPT. Okay, very good. So we will wait for others to join and then we will start today's session. Okay, let us wait for 5 more minutes, then we will start the session at 10 a.m. Okay. Okay, so I think I can start the session. So I think my voice is audible and everything is fine with the PPT and my video. And if any problem arises, please do let me know in the chat box. Okay, I will resolve it quickly. If there is any internet disruption due to which my I got disconnect, so please wait for some time. Okay, don't leave the class because I will rejoin as soon as possible. So don't worry about it. So very good morning to the students who have joined. My name is Moshumi Dev and I am the PMRF fellow from the Department of Chemistry and Chemical Biology, IIT ISM Dhanbad. So today it is the last live session for the NPTEL course of Medicinal Chemistry. So in this session, like yesterday we discussed about many things related to the medicinal chemistry course. Like we started with the clinical trials, then we go to the regulatory bodies and IPR, all these things. Then we discussed about pharmacokinetics, pharmacodynamics, and then we move into the enzyme kinetics, the enzymes which helps us to metabolize the drugs and all things. But today the things and then we discussed few questions related to the topics, and all the students have responded very well. So I think it was a very interesting to know that how the things work in the medicinal chemistry. So now in today's live session, it will be only 1 hour class. So we will go have a very short quick revision to the things we have learned so far. So in medicinal chemistry, the most important thing which I think and most interesting thing for many students, including me, including myself, was the different classes of drugs, like the antibiotic drugs, like antifungal, antiviral, anti-cancer drugs, how the drugs work. And what is the mechanism of action of the drugs, and what are the examples of different kind of drug, what are the chemical classes. So this is the thing which are very important as well as very interesting to know. So that's why in this today's class I will try to recall those things, and I will try to get a quick revision to the classes of drugs which we have learned in this course in previous weeks. Okay, and after that we will have 3 to 4 questions, and on those 3 to 4 questions we will just have quick revision to know so if you have learned the things better or if you remember the things. Okay. So yeah, so it is I think we should start the class. Okay, so in between, if you have any doubt regarding any slide or anything, you can just write in the chat box. Okay, in between or at the end of the session I will try to answer those queries. So it will be the last class, so if you have any doubt, anything after today's class, you can just directly mail me. Okay, you can drop an email to me, I will try to answer those queries before your examinations. Okay, so I think we can start today's class. And if you have any problem due to internet connection, so don't worry, this lecture PPT and this video will be available to you by NPTEL website. Okay, so I think we should start today's class. Okay, so the medicinal class which we had learned at very beginning in this NPTEL course was the antibiotics. So antibiotics, so in this course we have seen the differences between a bacteria and the viruses. Okay, and the antibiotics are so antibiotics are very important class of a medicinal drugs, because in our body bacteria are in a very important role. There are very good bacteria in our body as well as the harmful bacteria. Okay, but when you are taking antibiotics, sometimes it happens like the antibiotics kill the good bacteria also in our body. Okay, that's why to choose a particular to choose a very important class, it is very important to choose the correct class of antibiotic, okay, for a particular disease. So these are various classes of antibiotics, okay, which are today in the market. So the most important class of the antibiotics is the penicillins, right. So the penicillins, and then there are cephalosporins. The penicillin and cephalosporins, they are structurally almost similar because they have a beta lactam ring here, and you can see there is a beta lactam ring here also, and this is a bicyclic rings. Okay, so the structure of the penicillin and cephalosporins are more or less same. So this is the pipeline how the generation of different particular class of antibiotic is comes like this. Okay, the first and the generation 1 class of penicillin was the penicillin G, as you can see in the structure of here. So this is the structure which is shown in black. It is the main core of the penicillin. Okay, and all the modification has been done on this side chain with this R group, which is shown in red here. So, the generation 1, it had this C double bond O, CH2, and this is a benzylic kind of ring here. Okay, and the penicillin G was the generation 1. After the modification, the generation 2 antibiotic was the amoxicillin, and as you can see the structure of amoxicillin, it has a NH2 group here and then it has a OH group here. Okay. After the generation, there comes the generation 3, which is a ticarcillin, and it has a different kind of ring here, and then we have this piperacillin, okay, which has a more complicated structure. So, these generation actually come to see when a particular generation of antibiotic got drug resistance due to various reasons. There may be the reasons like efflux pumps, the reasons of we have also seen that how the drug resistance comes. There may be the drugs can be resistant due to the efflux pumps or due to the substrate over production, or there are many other reasons by which the drug resistance can happen. So, after that, so that is why the different generation of a particular class of drugs are important. When a particular generation of drug gets the drug resistance, then other generations they come to minimize the resistance and to be active again. Okay. So, after penicillin we have cephalosporins, which has structural similarity with the penicillin, okay, and here the change of modification can be done on 2 positions, this R1 and also this R2 position. Okay, this code in black, it is same for all generation, but this R1, R2 they vary from generation to generation. So, the first generation cephalosporin drug was the cephalotin, which is have this structure. Then comes the cefuroxime, which has this structure, then ceftazidime, and then cefepime. Okay. Then we have quinolone class of the drugs, and in this quinolone class, this is the core, which is a quinolone ring. Okay, and this again here the modification can be done on R1, R2, R3, 3 positions. Okay. The first generation quinolone drug was the nalidixic acid. Then we go to the ciprofloxacin, then levofloxacin, then moxifloxacin. Then remembering the names of the drugs are very important. See, if you do not remember the exact structure of the drug, but you should know what is the main core of the drug. Like in the penicillin and cephalosporin, these are the beta lactam ring containing antibiotics. Quinolone have this particular quinolone ring, because of this it is called quinolones. And if you there may be some questions like you are giving a name the ciprofloxacin, and you have been asked to write the mechanism of action, then you have to remember the ciprofloxacin is a quinolone class of the drug, and then you have to write the mechanism of action of this particular class. So, if you do not remember the exact structure of each and every drug, it is all right, but remember the main core of the drug, which is given like this. These are the main cores of the drugs. Okay, just remember this cores. Especially for the penicillin, cephalosporin, quinolones, and also for tetracyclines. So, remember the cores, what is the main core, this structure, and if you remember few names of the drugs. Okay, so that if the names are given, you should remember what is the class of the drug and what is the mechanism of action. Then we have the macrolide. Macrolides are called macrolide because it is a very huge chain of so many carbons are there. So, remembering the structure of this molecules are pointless, but remember the names, because the question can become as like this: the erythromycin is which class of the drug, or the erythromycin or terathromycin. So, remember the these things. Okay. Then we have the tetracycline like oxytetracycline, doxycycline, tigecycline, and the main code is this. This is called tetracycline because we have 4 rings joined together in a fused manner. Okay, that is why it is called tetracyclines. But so, for remembering the names of the drugs are important, and remembering the broad structure. And the most important thing which you have to remember in the antibiotics is the mechanism of action of a particular class of antibiotic. So, what is the mechanism of action of every antibiotic? See, these are the various mechanisms by which an antibiotic can work out. This is the cell wall synthesis. Cell wall synthesis can be inhibited by different class of antibiotics like cycloserine, vancomycin, bacitracin, penicillin, cephalosporin, monobactams, carbapenems. So, these are the antibiotics which actually inhibit the cell wall synthesis of the bacteria. Folic acid metabolism can be hindered like this THF, DHF and para-aminobenzoic acid. This pathway can be inhibited by the trimethoprim and sulfonamide. I have discussed it in the last class as I remember. This is para-aminobenzoic acid. This para-aminobenzoic acid actually converted to this DHF and then THF, and this is a folic acid metabolism metabolism pathway. So, this first step of this folic acid metabolism, para-aminobenzoic acid to DHF, it can be inhibited by this sulfonamides, because sulfonamides have structural similarity with this para-aminobenzoic acid, and that is how they actually inhibit this particular pathway. And the conversion of DHF to THF, dihydrofolate to tetrahydrofolate, this pathway is inhibited by the dimethoprim. This is also I have discussed in the class number 11 or 12, I do not remember exactly, but I have discussed it. Okay. If you check the previous lab PPTs, you will find it out there in detail. So, this was the folic acid metabolism here, which can be hindered by this antibiotic class of drugs. Okay. Then there comes the cytoplasmic membrane structure and function. Polymyxins and daptomycin, these compounds can inhibit this function of the cytoplasmic membrane structure and function formation. Okay. Then we come that this is the cytoplasmic membrane, this is the cell wall, this is the plantasemicin, which is inhibit the lipid biosynthesis. Then comes the more important this protein synthesis. This tRNA can be inhibited by this mupirocin and puromycin, and then comes the protein synthesis of 30S inhibitors, which are the, so this is the bacterial ribosome. Okay. We all know the prokaryotic ribosome, they are divided into two subunits. There is a 50S subunit and there is a 30S subunit, and the eukaryotic ribosome, they have two subunits, which is 60S subunit and 40S subunit. Okay. So, this is the bacterial ribosome. So, there are few compounds. So, there are few drugs which actually inhibit the protein synthesis of the bacterial cell by adding up or by binding with the different subunits of the ribosomes. Like protein synthesis can be inhibited by the 30S inhibitors, the compounds which bind to the 30S subunit of the particular ribosome. These are the tetracyclines, spectinomycin, streptomycin, gentamicin, kanamycin, amikacin, non-nitrofuran. So, this compound, these antibiotics bind to the 30S subunit of ribosome, that is how they inhibit the protein synthesis. Now, protein synthesis can be inhibited by the 50S inhibitors, which bind to the 50S subunit of the ribosomes. The examples are erythromycin, so, the example for the 50S inhibitors are the erythromycin, which are the macrolide class of the compound, the chloramphenicol, the clindamycin, linomycin, these are the protein synthesis inhibitors which bind with the 50S subunit of the ribosome, and then they inhibit the mechanism, activity for the protein synthesis of by the bacteria. That is how they act as they exert their antibiotic activity. DNA directed RNA polymerase can be inhibited by the rifampicin and streptoviricins. Okay. And RNA elongations, this can be inhibited by the actinomycin, and there is an important class of the drug which are quinolone, they act on the DNA guidance. Okay. And by acting on DNA guidance, they actually inhibit the DNA synthesis by this particular bacterial cell, and the examples are nalidixic acid, ciprofloxacin, novomycin. Okay. So, they inhibit the DNA guidance, and that is how they exert their antibiotic activity. So, as I have said, what topics are important from the antibiotic? The important topics are that you have to remember what are the class of particular antibiotic. These are penicillin, cephalosporin, quinolone, macrolide, tetracycline. These 5 class of compounds are the most important class of the antibiotics. What is the broad structure? This penicillin has this broad structure which is in the black one. Okay, and the R is the where the changes happen. For the cephalosporin is the same, for quinolone, macrolide, tetracycline. So, it is important to remember the broad structure for the, so you do not need to exact structure, you do not need to remember, but you need to remember the broad structure of the penicillin, cephalosporin, quinolone and tetracycline. Macrolide you do not need to remember the broad structure, but just remember how the structure looks like, because if you are given a particular structure and you are asked that write the name of the particular class of the drug, you should know what is is the particular class of the drug. And again you need to remember what are the different classes mechanism of action, like cell wall synthesis inhibition, folic acid metabolism inhibition, cytoplasmic membrane structure function inhibition, lipid biosynthesis, protein synthesis inhibition, DNA directed RNA polymerase inhibition, RNA elongation, DNA guidase inhibition. So, these are the various methods of action for the different classes of antibiotics. So, this is a very important thing which you have to remember. Okay. Now, next which we will discuss is the antifungal drugs. So, antifungal drugs are the medicine which are deployed in the treatment of mycosis. Fungal infection of the skins are as of 2010 is the fourth most common disease in the world, affecting 1 billion people. So, these are the different classes of the antifungal drug. Okay. Imidazole class of compound. So, imidazoles are as we all know what is the structure of imidazole. This is a 5-member ring which have nitrogens in 1 and 3 position. So, most of the actually antifungal drugs have the azole, any one of the azole, it may be imidazole or pyrazole or triazole, okay, any or tetrazole also. So, different classes of antifungal drug have this azole moiety in very frequently. So, most commonly used is the imidazole. So, these are the examples of the imidazole ring containing antifungal drugs, which are the clotrimazole, oxyconazole, miconazole, iconazole, ticonazole, ketonazole. Okay. Triazole class of drugs, it can be fluconazole, itraconazole, tetraconazole, voriconazole, isobucanazole, posanazole. Okay. These are the azole antifungals, and what is the mechanism of actions. Okay. So, you remembering the mechanism of action is very important. So, the mechanism of action is inhibition of lanosterol 14 alpha demethylase, the enzyme required to convert lanosterol to ergosterol. So, this is the mechanism of action for this imidazole and triazoles. Okay. Then we have cresoflavin class of compound which inhibit the mitosis of dermatophytes. It is ineffective when applied topically. Okay. Flucytosine, which is the pyrimidine analog which converted into 5-fluorouracil by the fungal enzyme cytosine deaminase, active against yeast infections. Then we have polyenes. Okay. Then polyenes is the natamycin and there is amphotericin and nistacin. Then we have allylamines. Okay. So, amorphilin, natafin, terbinafine, these inhibit the squalene epoxides. And then we have the echinocandins which has the caspofungin, anidofungin and mycofungin. They inhibit cell wall synthesis by targeting glucans or 1,3 beta glucan synthesis. So, mitosis is a fungal infection in animal including human. Mycosis are the common and very variety of environmental physiological condition can contribute development of fungal diseases. Okay. So, triazoles are newer and the less toxic and more effective class of the for the this antifungal drug, like fluconazole, itraconazole, albuconazole, posaconazole and voriconazole. So, these are the triazole containing antifungal drug. This is the structure of fluconazole, this is the structure for the voriconazole and this is the albuconazole. So, this structure we have some question related to the fluconazole in some week. So, you can understand this is a very important class of the drug, and like other imidazole and triazole class antifungal, fluconazole inhibit the fungal cytochrome P450 enzyme 14 alpha demethylase. Mammalian demethylase activity is much less sensitive to the fluconazole than fungal demethylase. This inhibition prevents the conversion of lanosterol to ergosterol, an essential component of the fungal cytoplasmic membrane, and subsequent accumulation of 14 alpha methylsterols. Fluconazole is an inhibitor of the human cytochrome P450 system, particularly the isosome CYP2C19, CYP3A4 and CYP2C9 are lesser extent. In theory, therefore, fluconazole decreases the metabolism, increases the concentration of any drug metabolized by these enzymes. In addition, in the potential effect on the QT interval increases the risk of cardiac arrhythmia if used concurrently with other drugs that prolong the QT interval. So, this is the mechanism of action of fluconazole and very few topics. So, as you can see, there is a 1 to 4 triazole ring is present in the fluconazole. Okay. So, another class of very important drugs are the antihypertensive drugs which are used for the lowering the pressure of the blood. Okay. So, there are different classes of antihypertensive drugs are diuretics, angiotensin converting enzyme or ACE inhibitors, angiotensin AT1 blockers, adrenergic receptor antagonist or beta blocker. Okay. So, again I will say which is more important is to remember the mechanism of action of each and every class of drug, and and remember few names of few examples of the drugs. So, diuretics, this is the first class and very commonly used class of the antihypertensive drug. What is the mechanism of action? The mechanism of action acts on the kidneys to increase the excretion of the sodium and water and decrease the blood volume and decrease the blood pressure. Okay, this is the mechanism of action for the diuret. And what are the examples? The examples are the thiazides, which are hydrochlorothiazide or chlorothiazide, and the high saline, which are furosemide, and potassium plus purine, which are the spironolactone, and these are the various example of diurets. Okay. Amiloride is a very important and very commonly used drug for the diurets. There is angiotensin converting enzyme and EC inhibitors. So, I have in one class I discussed about how the angiotensin converting enzyme works, how the whole mechanism or whole cycle works actually. So, angiotensin converting enzyme inhibitors, so they actually inhibit the conversion of angiotensin 1 to angiotensin 2, and inhibiting the synthesis of angiotensin 2, they decrease the peripheral resistance and blood volume. And the examples are captopril. Okay, the examples are captopril, lisinopril, enalapril, ramipril, and fosinopril. So, this is the angiotensin converting enzyme, which is a very important class of the antihypertensive drug. The name ended with syn are the protein synthesis inhibitor, the drug name. Okay, yeah. So, I will go to this place. Yeah. So, this was the, yeah, you can say the name, not exactly the name ended with the syn should not be the protein synthesis inhibitor. Yeah, you can say, but there may be some example. See, as you can see here are the example like ciprofloxacin, novobiocin, they also ended with the suffix syn, right, but these are not the protein synthesis inhibitor, they are the DNA guidase inhibitor. Like actinomycin, it is also ending with syn, CIN, but it is not a protein synthesis inhibitor, it is RNA elongation, it is working here. Then here daptomycin, it is also ended with syn. So, you cannot say that here it is bacteriocin. So, it is also not ending with syn, but it is not a protein synthesis inhibitor. So, it is not like all compound or drug name ending with syn is a protein synthesis inhibitor. Okay, you cannot say it. Okay. So, this is not a thing, but yeah, you can remember like this here. If the drug name it is ending with syn, as you can say, not syn, it is if it is oxazin or floxacin, it will be quinolone class of drug. But if it is like mycin, then it will be macrolide class of drug. And then if it is cycline, then it is this kind of drug. So, this is the way of remembering. Okay. So, we cannot say like if it will be ending with syn, it is a particularly protein synthesis inhibitor, we cannot say it. Okay. So, we were at the antihypertensive drugs. So, then we have the angiotensin 81 blockers, which have this losartan, candenocertan, valsartan, termecertan. Here also you will see in the names we will have very much common, and you will remember it. Like the mechanism of action for this block binding of angiotensin 2 to its receptor. So, this is angiotensin 81 blockers, and then we have adrenergic receptor antagonists, which are called the beta blocker. Beta blocker, they competitive antagonists that block the receptor site on the adrenergic beta receptor, and beta blockers are used for the particularly in the younger patients for the who have the high blood pressure. And beta blockers actually they it not only lower the blood pressure, it also used for the anxiety. Okay, the anxiety, palpitation, the higher high heartbeat range. Okay, so for this beta blockers are used. So, when you see the names of the drugs, you will see there are something which are the drug name ending. So, in case of antihypertensive drug, remember like if the drug name is ended with pril, PRIL, then it will be like angiotensin converting enzyme inhibitor, ACE inhibitor. If it is ending with sartan, SARTAN, then it will be 81 blockers. and if it is ended with LOL LOL, then it will be like beta blocker, like propanolol and nebivolol, atenolol. So it may be possible like you are given a particular name of the drug like nebivolol, and then you will ask write the mechanism of action. Then remember, like nebivolol, it is ending with this. This is in the beta blocker class of antihypertensive drug. Then write the mechanism of action for the particular drug. Okay. So that's how we remember these things. Then we have very important topic, which is the antiviral drugs. So for the antiviral drug, I will discuss only for the drugs which are the for the HIV. So HIV-1 is the most common type of human immunodeficiency virus. It attacks your body's immune system. The virus destroys CD4 cells. These cells help your body fight infection. HIV-1 can severely damage your immune system and lead to acute immunodeficiency syndrome or AIDS. Okay. CD4 cells are white blood cells that play an important role in immune system. Your CD4 cell count gives you an indication that of your health or immune system, your body's natural defense system against the pathogen, infection and illness. Currently, there is no cure for the HIV or AIDS. Once you have the infection, your body can get rid of it. However, there are many medications that can control HIV and prevent complications. These medications are called the antiretroviral therapy or ART. So these are the several classes of compounds which are used to tackle the HIV AIDS. So the first one is the reverse transcription inhibitors. So reverse transcription transcriptase is the RNA dependent DNA polymerase that utilizes a strand of RNA to synthesize double stranded viral DNA. This mechanism helps the retroviral gene to get incorporated into the host cell's gene. The various RT inhibitors are developed which on the basis of the binding site and chemical class of compounds are classified into NRTIs, nucleoside reverse transcription inhibitors, and NNRTIs, non-nucleoside reverse transcript inhibitors. Okay. So what are the so there are NNRTIs which are non-nucleoside reverse transcriptase inhibitors. So among the HIV RT inhibitors, reverse transcript inhibitor, non-nucleoside reverse transcriptase inhibitors have gained a definite place due to their unique antiviral potency, high specificity, low toxicity in antiviral combination therapies used to treat HIV. And nucleoside reverse transcriptase inhibitors, while NRTIs and they are alike are effective terminating DNA synthesis and HIV replication. So NRTIs inhibit reverse transcription by causing the chain termination after they have been incorporated into the viral DNA. This was the first group of antiretroviral agents to be used against HIV. NRTIs lack 3' hydroxyl group in the deoxyribose moiety. As a result, following incorporation of an NRTI, the next incoming dinucleoside cannot form a 5' 3' phosphodiester bond needed to extend the DNA chain. Thus, when NRTI are incorporated, viral DNA synthesis is halted, the process known as chain termination. All NRTIs are classified as competitive substrate inhibitors. Okay? And then we have the protease inhibitors. Proteases are the enzyme that cleave the protein molecules into smaller fragments. HIV protease is vital for both viral replication within the cell and release of the mature viral particles from the infected cell. Various protease inhibitors are developed for the HIV treatment. Some of the FDA approved drugs are the sacubitril, indinavir, atazanavir, ritonavir, and these are the class of the protease inhibitors. See here also, if the drug name is ending with NAVIR, navir, so it will be a protease inhibitor. That is how you will remember the names of the particular class of the drugs. Okay. So these are few examples or few range of treatment for the particular antiviral as antiviral agent for the HIV AIDS. Okay. So now this was all about the AIDS. So we will move toward our next topic. So one more thing we will discuss today about the which are the anti-cancer drugs, especially with the kinase inhibitors. So kinase inhibitors, I have always I think have discussed about this class of drugs, because these are comparatively newer class of anti-cancer drugs. Okay. So protein kinase, it is an enzyme that catalyzes the transfer of the phosphate groups from high energy phosphate donating molecules to specific substrate. The process known as the phosphorylation, where the substrate gain a phosphate group and the high energy ATP molecule donates the phosphate group. The enzyme involved in many biochemical signaling pathways within the cells, that is signal transduction, and effectors in cellular functions such as cell proliferation and apoptosis. So, here we have the substrate and then we have the ATP and kinase. What will the kinase do? It will just transfer the phosphate of the gamma phosphate from the ATP to the substrate, okay, and the ATP will be converted to the ADP molecule. And so, this is the mechanism. So, this is the ATP, this is the serine, this is threonine and tyrosine. Mainly these 3 amino acid have this hydroxyl group, okay, and gamma hydroxyl group, and this hydroxyl group will actually take up this particular phosphate from this ATP, and that is how it will act. Okay, so this is the mechanism how the phosphate kinases work. So, this is substrate and ATP. The kinase what will be do? It will just make substrate phosphorylated and it will be ADP. Okay, so this is it will be ADP. It is wrong here. Pen. So it will be ADP. Okay, and phosphatase it actually converts this is a catalyzer reverse reaction of the kinases. Okay. So, protein kinases can be serine threonine kinase or tyrosine kinase. As I have shown you, like serine, there is a structure of serine, threonine and the tyrosine. They also have a hydroxyl group which can be phosphorylated by the particular kinases. So, it can be serine threonine kinase or tyrosine kinase. Serine threonine kinases can be receptor serine threonine kinases which are TGA beta, and non-receptor serine threonine kinases which can be PKA, PKC and MAP kinase, Aurora kinase. These are the examples. Then tyrosine kinase, receptor tyrosine kinases are EGFR, PDGFR, FGFR etc. and non-receptor tyrosine kinases, they are CSRC, BCR-ABL etc. So, these are the examples, and human genome have 30 to 35k genes, and the protein kinase gene is 518 and protein phosphatase gene is almost 100. Okay. Now, how the kinases work? Okay, we will have to move this. How, so why kinase inhibitors are important? How the kinase inhibitor acts as an anti-cancer drug? So, as you can see, this is the protein kinase and this is the protein which have a this hydroxyl group, and protein kinase it makes this protein chain phosphorylated by using ATP to the ADP. Okay, and this is serine, threonine or tyrosine side chain. So, protein kinases they actually this is the cell. Okay, and growth factor attached to the receptor is here, receptor of the cell division, and there is a tyrosine kinase starts the signal. So, when the growth factor is attached to the receptor, the kinase tyrosine kinase they start signal. Okay, and this signal for the cell to divide, and then the cell will divide into the two positions. So, that is how this overexpression of this particular receptors and the tyrosine kinase, the malignancy of the cell will happen, and we all know why the anti-cancer is, how the cancer is happens, this due to the malignancy of the cell, the uncontrollable cell division happens, right. So, that is how the kinase is the signal, and this is the reason why the cancer cell happen in most of the cases. So, what is the chemical features for a kinase inhibitor? So, this is a ATP binding pocket for the kinase enzymes, okay, and this is called the hinge region for the particular nearby the ATP binding pocket. So, this is the ADP and this is the adenine ring, and this is the adenine region. There is a hydrogen bonding with ATP with here. Then we have the sugar moiety here, which is the sugar region. This is the solvent accessible region. This is the back pocket, and this is the phosphate region. Okay. So, any compound to be kinase inhibitor, it must act as fit into the ATP binding pocket, and it must bind with the hydrogen bonding with the particular hinge region for the kinase enzyme. So, for an example, treatment of leukemia, inhibition of the BCR-ABL kinase. So, BCR-ABL active substrate protein is here, and this is the BCR-ABL, this is the substrate protein, and this is the ATP here, ATP binds here, okay, and the ATP converted into ADP and activating the phosphate, and the signal of proliferation and survival and leukemia happens, okay. But when this is blocked here by the Gleevec, so Gleevec is a kinase inhibitor molecule drug. So, when the ATP binding site is inhibited by the Gleevec, what will happen? There will be no phosphorylation, no signal, no new leukemia. So that's how the kinase inhibitors act. They bind to the ATP binding pocket for the kinase, so that the ATP cannot bind to the particular pocket. If the ATP cannot bind, the substrate will not be phosphorylated by the particular kinase. Okay. So there are many type of kinase inhibitor. It can be type 1, type 2, type 3, type 4. Different kind of kinase inhibitors are there. Type 1 kinase inhibitor, mainly they bind to the ATP binding pocket, and type 2 inhibitors, they can in the DFG in DFG out motif there is something called. So this is not out of your syllabus, so I won't discuss it much. And there is also covalent inhibitors or allosteric inhibitors also there. So there are different kind of kinase inhibitors, and this is a very important class of the anti-cancer drugs. Okay. So now we have discussed many things about the different classes of antibiotics. So now I will give you 3 to 4 questions, and I want all of you to try to answer the questions. Okay. So the first question is, calcium channel blockers are used for number A, hypertension and heart disease, number B, leukemia, number C, peptic ulcer, number D, type 2 diabetes. I want all of the students present in the class to answer the question. It does not matter if the answer is right or wrong, but since it is our last class, I want all of you to answer and respond and write in the chat box which of the following you think is the correct answer. Calcium channel blockers are used for hypertension and heart disease, leukemia, peptic ulcer or type 2 diabetes. So do we have any answers for it? Number A, number A, number A, number A. Okay. Why only ATP donate the phosphate but not GTP, UTP or CTP? Okay, so there is a reason why ATP only donate the substrate, because particularly the binding pocket which is of the particular ATP. So the binding pocket for the kinases, it is designed such a way that ATP only can donate the phosphate, because ATP has a very high energy. So that's why, because only ATP can donate the phosphate, not the others. Okay. So correct answer is yes, number A, hypertension and heart diseases. So mechanism of action, calcium channel blockers have 4 effects. They act on vascular smooth muscle, reduce contraction of the arteries and cause vasodilation. They act on cardiac muscles, myocardium. They reduce the force of the contraction of heart, negative inotropic. They slow down the contraction of electric activity. Activity within the heart, slow down the heartbeat, negative tonotropic. They block the calcium signal on the adrenaline cortex cell, and they directly reduce the aldosterone production, which correlates the lower blood pressure. Therapeutic uses of the calcium channel blockers: the angina pectoris, cardiac failure, dysrhythmias, hypertension, migraine, and orthostatic hypotension and tachycardia. Okay, these are the side effects. Nevirapine is a drug which is, so next question is, nevirapine is a drug which is an dash inhibitor of reverse transcriptase. Your options are number A, allosteric, number B, non-nucleoside, number C, non-competitive, number D, all of these. Try to answer this question. Nevirapine is a drug which is an dash inhibitor of reverse transcriptase. So, have you answered this question? Number D, number D, number D. So, number D. Okay, let us check. Yeah, very good. So, correct answer is number D, all of this. So, see, this is the nevirapine. So, it is a non-nucleoside reverse transcriptase inhibitor. Okay, and mechanism of action, they act by stopping HIV production by binding directly onto reverse transcriptase non-competitively and preventing the conversion of RNA to DNA. Do not require activation through the phosphorylation. And this is the example of non-competitive inhibition. This is the enzyme active site, and then in non-competitive inhibition is distinguished from the general mixed inhibition is that the inhibitor has an equal affinity for the enzyme than the enzyme substrate complex. Okay. So, in non-competitive inhibition, inhibitor binds to the into the site, not the active site, in the allosteric site. Okay. Next question, what is the correct order of intermediate in route of cholesterol biosynthesis? Your options are number A, HMG-CoA to mevalonic acid to squalene, number B, squalene to HMG-CoA to 7-dehydrocholesterol, number C, mevalonic acid to farnesyl diphosphate to squalene, number D, acetyl-CoA to HMG-CoA to squalene. What is the correct order of intermediate in route of the cholesterol biosynthesis? Cholesterol biosynthesis is another very important thing which happens in our body, and there are a class of drug which I have not discussed, but I will discuss it soon, which is actually the cholesterol anti-cholesterol drug, you can say, which are used for to lowering the higher levels of cholesterol in our body. So, we will discuss it later. So, do we have any answers for this question? Number A, number B, number A. Okay, so A and B seems to be most common answers, right? So, correct answer is actually number C, mevalonic acid to farnesyl diphosphate to squalene. I will show you the pathway. So, this is the pathway of the cholesterol biosynthesis happen. Okay. So, this is a very important actually to remember few steps. So, first the cholesterol biosynthesis starts with the acetyl-CoA. The acetyl-CoA is converted to the acetoacetyl-CoA by acetoacetyl-CoA thiolase. Then this acetoacetyl-CoA it converted to 3-hydroxy 3-methyl-glutaryl-CoA by HMG-CoA reductase. Okay. Then it converts to the mevalonic acid, and then the mevalonic acid is converted to farnesyl diphosphate, which converted to squalene by squalene synthesis. And in the last step there is a 7-dehydrocholesterol which is converted to cholesterol by 7-dehydrocholesterol reductase. Okay. So, this is the pathway of cholesterol biosynthesis. Just remember it starts with the acetyl-CoA and the intermediates, few intermediates like this 3-hydroxy, this is the acetoacetyl-CoA, there is a HMG-CoA synthesis, then HMG-CoA reductase. So, these enzymes are very important for the cholesterol biosynthesis. Okay. So, if you are given the name of the enzyme, so remember these are actually related with the cholesterol biosynthesis. Now, next question, it is the statins works as number A, HMG-CoA synthesis inhibitor, number B, HMG-CoA reductase inhibitor, number C, squalene synthesis inhibitor, and number D, acetoacetyl-CoA thiolase inhibitor. So, statins actually are the class of drugs which are used for tackling the higher levels of cholesterol in our body. For example, atorvastatin, I do not know if you have heard this about this drug or not. If there are any patient or any aged person in our home who are taking the drugs of the cholesterol, you can check, they are mainly statins are the class of the drug which are used to tackle the high levels of cholesterol. So, these statins actually they inhibit a particular enzyme in the biosynthetic pathway of the cholesterol, and you have to find out what is the enzyme which it inhibits. Is it HMG-CoA synthesis? Is it HMG-CoA reductase? It is squalene, or is it acetoacetyl-CoA thiolase? Do you have any answer for it? Number A. So, now I think number A and number B are the most common answers. So, let me check. So, correct answer is number B, it is HMG-CoA reductase inhibitor. So, in HMG-CoA reductase, so where this enzyme works, HMG-CoA reductase, it actually catalyzes the synthesis of the mevalonic acid from 3-hydroxy 3-methyl-glucuryl-CoA. Okay. So, this statins, they actually inhibit that particular pathway. So, the mechanism of action, these are the analog of HMG-CoA, competitive inhibitor of HMG-CoA reductase. The rate limiting step in the cholesterol synthesis, reduced hepatic cholesterol results in the increase in LDL receptor expression, which increases the removal of the LDL from the body, and reduced hepatic cholesterol results in the decrease in VLDL synthesis and secretion. Adverse effect, hepatotoxicity, myopathy rarely occurs, and they contracted in during pregnancy. So, statins are very important class of the anti-cholesterol drugs. Like atorvastatin, as I have said you, like it is a very much commonly used or frequently used drug to lower the cholesterol levels in our body. Okay. Now, the enzyme which catalyzes fibrinogen to fibrin conversion is number A, trypsin, number B, thrombin, number C, prothrombin, number D, pepsin. Fibrinogen to fibrin conversion, as we all know, it happens during the blood, the clotting of the blood or all those things. Okay. So, whenever you have a cut so there the blood vessels start to repair those cut by clotting the blood there, so that there is no blood loss from our body. So, particular enzyme this catalyzes the fibrinogen to fibrin conversion. Now, you have to find out which is the particular enzyme. It is trypsin, thrombin, prothrombin and pepsin. So, is there any answers for this question? Number B. Okay, so number B seems to be the most common, right? Let me check. Very good. The correct answer is thrombin. So, this is the mechanism. So, as you can see, if there is a blood clot there, and then this clot when there is a cut, so the all the enzymes they act to clot the blood, so that there is no blood loss. Okay, the clot initiation, it happens like platelet aggregation, activation and coagulation. Then it actually activation of coagulation, they in there is a thrombin. Then this thrombin it catalyzes the reaction of from fibrinogen to fibrin. This fibrin makes the fibrin polymer, which actually forms the clot, and then fibrinolizes this fibrin fragment. They actually resolve this. So, this is the prothrombin. Prothrombin is converted to thrombin by prothrombin activator or calcium ion, and then prothrombin is activated fibrin stabilizing factors. The prothrombin this initiates the mechanism from fibrinogen to fibrinogen monomer to fibrin, and then this cross-link fibrin fibers happen, which actually initiates the blood clots, so that there is no blood loss from a particular disease, or for a particular for a particular injury. Okay. So, this was the last question of today's session, and this is the last question of the course also. So, as I have so this was a medicinal chemistry course for the NPTEL, and this course we see how the medicinal chemistry works, starting from the clinical trials, starting from the different classes of mechanisms like pharmacokinetic, pharmacodynamic parameters, metabolism, enzyme metabolism, phase 1, phase 2 metabolisms. Then we discussed about the different kind of drugs like anti-cancer, antiviral. Then we discussed about SAR, how the SAR had done, how the QSAR has done, and then in the last class we do show this slide for the antifungal drug. Okay, so don't worry, these slides I will actually since you are asking for it, I will show you, but all these slides I will share to you, and it will be shared to you by the NPTEL website. So, this was the slide for the antifungal drug. So, here we discussed about different classes of antifungal, what is the mechanism of actions. Okay. So, anything which I think if you have missed anything during today's class, so don't worry, this lecture video I will upload it into the YouTube, and it will be available to you by the NPTEL website. Also, this slide, this PPT, everything will be shared to you. So, you do not have to worry if you have missed anything. Okay. So, this was our last class where we discussed different kind of thing, different kind of drugs, different kind of medicinally active compounds, and in the last class we discussed about many things in the medicinal chemistry. So, this was the last class. We have completed 13 weeks in total, including today's class. So, for this course of medicinal chemistry, and so now it is for the next week you will have your examination from the 30, I think, and the examination related information, everything will be shared to you. Yeah, all the slides of the problem solving session, it will be shared to you by the NPTEL website. Okay. So, they will share you Google form there is not a Google form, they will share you a Google sheet. I will show you. So this kind of Google sheet will be shared to you, where you will have the YouTube link of the all classes and the presentation link of the all classes, and you can just check the thing from here. So these things will be uploaded to by the NPTEL website. Okay, so you can just collect the slides from there, and you can also check the videos from the slide. And I will just share my email ID here quickly. So if you have any doubt, any query, you can just drop a email to me. Okay, I will try to answer those query before your examination. Okay, so this is my email ID. So if you have any doubt regarding anything, you just drop me an email. I will try to answer your query. So this was the last class. So I thank you all for joining in today, and also I thank you all for attending the classes in for past 12 weeks, and which we completed. So thank you so much, and we will come. So if you have any query, any doubt, feel free to contact me. I have shared the books also. I think I have shown you the names of the books. So try to read from the book. I think you will definitely have a very good examination. So all the best to all the students for the examinations, and I will close the session for today, and we will meet for the next I think session in the next semester for the NPTEL, any other course for NPTEL. So now thank you all. So I will close the session for today.